Hi, my name is Olivia Habel and I'm a student nurse at Cedar Crest College. For my evidence-based practice paper and poster, my topic was the utilization of distraction techniques during injection or phlebotomy in children. This topic's important to me because hopefully one day I'll be able to work in pediatric, med-surg, or a PICU setting, and I'll be able to utilize these distraction techniques to not only lower distress and pain, but to also build a good rapport with my patient and their family members. My PICO question is, in children receiving injections or phlebotomy, does the use of distraction techniques compared to standard care result in a lower pain rating using the FACES pain scale or lower distress? This is my poster. I'm just going to go and talk about each section. So for significance of the problem, pain is experienced by children in healthcare settings can be very influential on how not only they interpret that experience, but also how they believe further experiences in the healthcare setting will go. This makes distraction being the most frequent intervention used in healthcare to not only achieve lowered pain and distress, but also to provide a good experience for children. It's important to keep in mind that sometimes children have a hard time expressing any pain they're feeling or if they're anxious. So as nurses, we have to not only assess verbal and nonverbal cues, but we also have to determine appropriate age, pain management tools and scales. So we are determining if the pain is actually lowered and distress is lowered, and determining if that's not the best tool to use for the patient, there are other tools available that could be explored and used. For process of lit search, the following databases were used: EBSCOhost, CINAHL, and Ovid. The keywords children, immunization, distraction, pain scale, and distress were used, with the correct linking term being the Boolean logic and or not. The limit was set from 2010 to present. Random control trial was selected along with full text, and the results yielded 25 for EBSCOhost, 9 for CINAHL, and 25 for Ovid. Out of all of those, I selected the top 3 based on the research answering my PICO question, the level and quality of the evidence found, and where that study fell on the continuum of hierarchy of evidence. There's just a picture of a distraction technique being used. So for synthesis of evidence, I chose CARCARA, CORE, and MOAD. So CARCARA is a random control trial, and the purpose was to determine the effect of a kaleidoscope on the pain level during venipuncture in children. The results show that the control group, those who did not have the kaleidoscope, reported significantly higher pain ratings than the experimental group who did have the kaleidoscope. So Core et al. Is my second study, and that's a quasi-experimental study, and this was to assess and evaluate the effect of cartoon distraction on pain perception and distress in children undergoing IV injections. The results of this study showed that at the initiation at 5 minutes and at the termination of the IV injection, those who were using cartoon distraction reported significantly lower pain ratings than those who did not watch cartoons. MOAD et al. Is a random control trial, and the purpose was to investigate the effect of external cold and vibrations using the buzzy on pain ratings in children, their parents, and nurses during peripheral IV insertion. The results showed that the children who used the buzzy had significantly lower pain ratings than the control group who did not utilize the buzzy. It's also interesting that the nurses had the same pain rating as the children, but the parents did not. So recommendations would be to evaluate and educate nurses on non-pharmacological distraction and pain methods, educate them on resources available, to them, such as child life specialists. You want to integrate distraction techniques into nursing practice due to the accessibility, the inexpensiveness, and how the effect decreases pain. You also want to analyze the effect of distraction on pain perception in all pediatric units, and you want to utilize distraction methods that are age appropriate. So, in conclusion, my evidence supports my PICO question that distraction does lower FACES pain scale and lowers distress. Nurses should collaborate with child life specialists to decrease pain, fear, and distress in all pediatric settings. And by doing all of this, you provide holistic care, you achieve pain management, and you reduce costs. Thank you for watching. Can't wait to see your comments.